Welcome back. Thank you so much for staying with Monday Special. Of course, tonight we're talking about hypertension, or the silent killer as it's being described. And in studio we have two panelists with us. We have Dr. Mohammed Jailan, who is a consultant cardiologist at the Aga Khan Hospital, who'll be taking us through everything from the symptoms, although of course a lot of the reading we've seen doesn't show any symptoms. But he's going to explain a lot about hypertension and also check my blood pressure, something I'm really nervous about. But it's okay, I'll be the bigger person and do it. And then we have Mary Eve, who is a case study. She's been hypertensive for about a decade now. She'll tell us more about how she's managed it for all this time. Thank you both so much for coming on the show tonight. Can I start with you, Dr. Jailan, and just take us through briefly what hypertension is and what causes it?
Well, I suppose to understand hypertension, you need to understand blood pressure.
Yeah.
So the blood pressure is a force that the blood exerts as it presses against the walls of the blood vessel. You have to remember that the heart is a pump, and it pumps blood, and every time it pumps blood, it pushes blood into the blood vessels, the arteries, and as it pushes blood into the arteries, the blood exerts a pressure against the walls of the blood vessels. When the heart is relaxing, there's still some blood in the blood vessels, and so you have two readings. You have the reading, the upper reading, which is the blood pressure as the blood is being pumped into the vessel, and that's usually a higher reading. And then you have the lower reading, the diastolic reading, which is the reading of the pressure when the heart is relaxing and is no longer forcing the blood in. Hypertension just means that your blood pressure is higher than normal, and if it's higher than normal, unfortunately it comes with lots of disadvantages, what we would describe as complications that will creep up on you over a matter of months or years and eventually cause problems in the future. So hypertension is high blood pressure, in short.
All right, then who does it affect and why?
Well, if you think about it, there's a normal range of blood pressure, just like there's a normal range of height and a normal range of weight. And hypertension, unfortunately, means that you're above the normal range. So there are many people affected. It tends to affect, at younger ages, men more than women, but above the age of 60, you'll find women catching up with men. It tends to affect people with diabetes, people who have high body mass, obese patients perhaps, and it tends to affect people who have adopted maybe more urban lifestyles. It can affect a large spread of patients, and what we're discovering now is that in Kenya we have a higher than average percentage of people with high blood pressure. We now have data that suggests that about 40% of adults above the age of 40 above the age of 40 have high blood pressure. So this is a large group of Kenyans who are suffering with this condition.
And it's down to lifestyle. I think that's what a lot of people's concern is that this is really a lifestyle disease, and that the more we take lifestyle for granted, the higher the chances of being hypertensive. Is there a link there?
There's a definite link. Most diseases are a combination between environmental factors, which are lifestyle factors if you like, and genetic factors. And a combination of those two will generally cause high blood pressure in most patients. There are some people who have high blood pressure that is related to an underlying cause. Maybe they have a problem with their kidneys or a problem with their heart or with their blood vessels. But the vast majority, I'd say about 95% of people, have hypertension which is called essential. In other words, they were probably destined to have high blood pressure, particularly if they picked up some of the lifestyle habits that we'll perhaps be talking about today.
A little later on. Okay, let's turn to Mary now. You're 29, you're almost 30 years old, and you said you first discovered you were hypertensive, what, about 10 years ago?
Yes.
Okay, could you tell us a little bit about that?
Okay. I was first diagnosed with hypertension in 2005. At that time, I really didn't know much about it. What happened? I used to nosebleed, severe headaches, fatigue, dizziness. So at first what I did, I used to rush to my nearest chemist, get some painkillers. It goes off, then comes back. Then it came this one time, I woke up one morning with a deviated mouth. I think the doctor will talk about it. It was I was told it was a minor stroke. So that's the time when the doctor said, I think you're hypertensive. At that time, it was at the peak, and it was really, really bad.
You were, what, 19? around at the time?
I was 20.
You were 20?
Yes, at 20.
Was your lifestyle, what kind of lifestyle were you living before then? Were you generally healthy? Were you not living a very healthy lifestyle?
Yeah, what I can say, since I was young, I think I was living a healthy lifestyle. Having been brought up from the village, the food, I can say that I was exposed to the to this fast food and all that.
Okay.
Yeah.
So you don't know what brought it on?
I don't know what brought my hypertension because it is not in the family.
Yeah.
This is something that just came up.
Okay.
Yeah.
What could have happened in her case?
In the vast majority of people who present with high blood pressure under the age of 25, if you like, there's commonly an underlying reason. It may not have been detected at the time or been understood at the time, but usually a problem either affecting the main blood vessels, narrowing the blood vessel. If you think about it, high blood pressure occurs because there's too much fluid, too much blood in the vessel that is containing it. And that can occur for a number of reasons. Either you've overdrunk, you've got too much fluid in your blood vessels, or your blood vessels have shrunk because they're narrowed in particular segments, or perhaps your kidneys don't work and they're not allowing the fluid out. So you're drinking and building up the pressure inside your blood vessels, but the kidneys are not working to produce enough urine. Of course, I don't know Mary previously, so we can only speculate, but I would suspect in somebody who presents with high blood pressure at that age that there may have been an underlying issue. Having said that, we do see some young people who present with high blood pressure without there being an underlying issue, and I guess we have to recognize that that can happen as well.
It's happening. Would you say there's a lot more younger people presenting with hypertension today than there was previously?
Yes, I think we're recognizing high blood pressure more as a society and as a community. I mean, in Kenya we tend to describe two conditions, pressure and sukari. So those are the sorts of things that people tend to know about nowadays. And often we're hearing about people getting checked. So it could be that we're just detecting it better.
Yeah.
But I suspect that there's an element of both. In other words, there are people who don't, who are getting high blood pressure at an unusually young age, or maybe at an earlier stage than they normally would.
Okay. Just before I come back to you, Mary, she talked about symptoms like bleeding and severe headaches. But at the same time, from what people read, there aren't really symptoms that present themselves when someone is hypertensive. Could you decipher that for us?
So most people who have high blood pressure, it's a bit like being a bit overweight. You may not know that you're a bit overweight. You may not be able to detect it. It may not actually produce symptoms at that stage. But eventually, as the pressure builds up, it causes problems in different organs. So the blood pressure can build up and, of course, cause too much pressure in the brain, and that can cause some of the symptoms we've described, particularly the headache. Some people complain of a pounding in the head. Some people describe visual disturbances, some blurred vision, and then you can have nosebleeds, and sometimes you can suffer a stroke or a mini stroke. Or you can have too much pressure in the kidneys, so you can have problems with the kidneys caused by the high blood pressure, or some bleeding in the urine. We can have too much pressure. The heart is pumping against too much pressure, so the heart weakens, tries to become too muscular, and then develops problems in the heart. So the blood pressure can cause problems as it causes complications.
Okay.
But in most people, it's silently there for many, many years, building up and slowly just, if you like, gnawing away at the organs and causing problems, and you detect it when it's a bit late.
Until it completely manifests itself. So then what happened? You went to the doctor. You found out you were hypertensive. How did your life change after that? Were you put on medication? Your lifestyle? How did it change?
Yes, I was put on medication. That up to date I'm still taking the medicines. But it happened that 2 years later I developed some kidney problem. I didn't really know what that was. When I went to the hospital, remember I went to Kenyatta Hospital, I saw a cardiologist. He was like, I think your kidneys are failing. At that time I was a bit, I didn't know, I was young, so I didn't understand. So 6 months later my kidneys failed. I was put on dialysis. Then when I went on dialysis, that's the time now my pressure exploded completely. It was now at the peak. I had to be put on medication.
And so what kind of life were you living? Do you remember how you were basically on a day-to-day basis? You said it exploded. The blood pressure exploded.
Yeah.
So what kind of state were you in at the time?
At that time, what happened? That's the time, like I said before, when I got the minor stroke. My mouth deviated, actually the whole of my face. So at that time, actually the doctors were a bit worried because they thought maybe this thing, with your blood pressure, we need to monitor you for some time. I was hospitalized for 2 weeks.
Okay.
Yeah.
And then after that?
After that, discharged, put on medication. I'm still on hypertensive medication up to date. Then I had to go on dialysis and all that. Yeah.
So what's your life been like for the past few years?
I can say it has been different. It's no longer the same life because most of the time when the blood pressure goes high, you will feel like you can't do those duties sometimes you used to. Because like, for example, in my case, I was in the hotel industry. At that time, the work became too much and the pressure, so I could not handle it. What I did now, I had to be given some light duties and
yeah, you just had to make an adjustment completely.
Yeah, you have to adjust.
Yeah.
Yeah.
What's the normal blood pressure reading, doctor?
So as I described, there are two readings. There's the upper reading, which is systolic blood pressure, and the lower reading, which is a diastolic reading. To have an entirely normal blood pressure, then theoretically your blood pressure should be less than 120, the upper reading, and less than 80, the lower reading. To have high blood pressure, which comes in different stages, I would normally describe that as a blood pressure of 140 over 90, and that's a sort of stage 1 blood pressure. So if you're between 120 and 140, for instance, that's what some people describe as pre-hypertension. In other words, the beginnings of high blood pressure. And if you have, if you like, full-blown hypertension, then you're talking about a reading of about 160 over 90, and that in itself, at that stage, depending on your age and your circumstances, it's very likely that you'll need treatment. You have to remember that blood pressure fluctuates. So right now, you're feeling nervous, you say. It's quite likely that your blood pressure is a little bit high, and it's common for stress to provoke changes in blood pressure. So most of my patients, if I monitor their blood pressure for 24 hours, 3 or 4 of those readings out of 50 will be very high readings, and they may be the first readings just as they're getting the monitor fitted and they're getting adjusted to it. So it's important not to just assume that on the basis of one reading you have hypertension or you have high blood pressure. So usually we want 2 or 3 readings or a period of monitoring that shows on average that the pressure is high.
All right, we have a question, I believe, on Twitter. Let's take a look at what some of you are asking. Let's bring that up now. And okay, at Maverick Nyambu says, is it true that high blood pressure increases kidney disease risk? Is it really more prevalent in African Americans? Maybe you can answer that for us.
Yes, it is true that high blood pressure increases the risk to the kidneys, because as a blood exerts pressure on the walls of the vessels, the walls become damaged, and their reaction to that is to shrink and to allow less blood into the kidneys and into the other vessels, and as a result that can cause problems with the kidneys. So sometimes it's difficult to know whether the kidney problem started before the high blood pressure problem, or the high blood pressure problem started before the kidney problem. I imagine in Mary's case we don't know, because we're not sure. In terms of whether it affects African Americans, there's no question that it does at an earlier age and at a higher rate. So and they have a different issue. African Americans are different from African Kenyans, and it's important to understand that. But most of the studies internationally that have been performed on African Americans, if you're talking about an African population. What they've discovered above all else is that African Americans have a very poor tolerance of salt. So salt, which encourages fluid to build up in the blood vessels, in other words, makes more blood inside the blood vessel, increases the pressure. The salt that many people will be able to tolerate, in the African American community, they don't tolerate it so well. So they tend to be more sensitive to salt.
Okay. Someone else asked about smoking and drinking and what role those play in hypertension.
So there's no question also that alcohol can contribute to increasing the pressure in the blood vessels. Smoking too, but remember that high blood pressure can cause problems like heart attacks, it can cause problems like strokes, it can cause problems with the kidneys and with the brain. And of course smoking can do the same, and alcohol can. So one of the things that we worry about when somebody's got high blood pressure is making sure that the other things that could also be causing problems to the other organs are under control. So we tend to advise people to try and lose weight, to try to avoid habits like smoking and drinking alcohol, and if they're diabetic in particular, that needs to be brought under control. Diabetes sufferers tend to be a unique group because they have double the rate of high blood pressure. Just having diabetes doubles your chance of having high blood pressure. So, and those two things can work together to cause problems.
Okay. Just before we take a quick break, hypertension can only be managed. It's not like it's something that can go away. So if I'm hypertensive today, I manage it with medication for life. Is that what happens with hypertensive patients, or is there, so to speak, or lack of a better word, a cure? Is there a way that it can completely go away?
I mean, that's an excellent question, and as I said, about 5% of patients have an underlying reason for the high blood pressure. And of course, if you eliminate the underlying reason, if the problem is a vessel that's been constricted and you open that up, then you can manage it. I have some patients whose blood pressure has been cured, if you like, and it's nothing that I've done. It's just some lifestyle modifications that they've introduced. So for instance, if you carry a lot of body weight, to get the blood circulating you need higher pressure than if you have less body weight. And if you manage to lose a lot of weight, it's quite possible that you can bring your blood pressure from the high range to the normal range. It's not normally purely related to high blood pressure, but I have you know, a small handful of patients who've managed to essentially come off medication because they've done those sorts of adjustments. And alcohol again, and other things like salt can be manipulated. Let's
see if we can take a look at some numbers in terms of statistics and see whether Dr. Mohammed Jilan can correct us if we're wrong. But this is what we know, that this is Kenya's male population, about 13,424,950 as of 2014. And of this population, let's take a look at how many are said to be hypertensive. About 4 million are affected. 4 million men in Kenya are hypertensive. And then for the next one, I think we'll have a look at the numbers for women. Yeah, the female population, there we have it, 13,417,983. And of this population, we have about 3.5 million women affected by hypertension. I think that's all we have. Yeah, that's accurate, Doctor?
I think that would probably be accurate. We're probably looking at statistics for the adult population above the age of maybe 18 or 21. And remember that above a certain age, high blood pressure builds up with age. Just like graying hair will eventually catch up with most of us. Many of us will eventually face high blood pressure. Not all of us, but many of us. And the figures that you're reading span the whole population. We have a younger population in our country than in other countries. And our rate of high blood pressure is just too high for our average population age.
So can children be hypertensive?
Yes, it's possible. It's something I discovered here. I mean, I did all my training in England, but I discovered here adolescent and child hypertension, and it was not related to an underlying cause in that population. But many people who are under the age of 25 who have high blood pressure will have it because there's an underlying reason.
I'll just run through a few questions quickly before we come to Mary and just ask you about life after, especially you know, the dialysis. And you've just mentioned something really powerful about support that's needed for that demographic, so I'll come to you just now. But is there a specific diet that works best for hypertensive patients?
Broadly speaking, yes. The diet that has been most studied and is well publicized is a diet called the DASH diet. And it essentially means that you do all the things that you know you're supposed to do. You're supposed to cut back on salt intake, you're supposed to eat low fat, low sugar diet, have lean protein, meat for instance, chicken and fish, and lots of vegetables and fruits. So if you adopt that kind of diet, there's some data that you can reduce your blood pressure points by about 10 in the upper reading. So dietary modifications can make a difference.
And what about hypertension in pregnant women?
Yes, it's a different condition. It's when a woman becomes pregnant, their body changes. They need more blood circulating, and as a result, not all of that is going for the baby. Some of that is just going to prepare the woman's organs. And as the amount of blood that circulates, the blood volume that circulates increases, the way the woman will respond to that varies from woman to woman. And so there's a type of hypertension that occurs only during pregnancy, and then as soon as baby is born and a few weeks later the blood pressure will settle down. The problem is that high blood pressure in pregnancy can cause problems with the baby, and also can cause problems and complications near the end of pregnancy. So it's very important to look for it, and once you've detected it, to manage it appropriately, and that requires specialist help.
All right, let's talk a little bit about medication and the fact that for a lot of people it's either inaccessible or very expensive. How did you manage to cost your treatment or to pay for it, and what are your thoughts on how maybe inaccessible medication is especially for Kenyans?
Okay, thank you, Janet. I would say for myself, I was lucky. I got someone who was willing to sponsor me. He's the one who has taken me through this journey. Even my post-medication, he's still supporting me in that. But there are so many people out there, those who have done transplants, that they cannot afford the medication. For example, let's take, for example, the Kenyatta Hospital, where most of the medicine has been subsidized. But you find that even after the subsidization, they still cannot afford to buy the medication. So what is happening? After people have done their transplants, some of them are losing their organs. It is really sad. It's so sad. When you donate your kidney to someone, then it fails because they cannot afford to buy the medication. So my appeal is to the government, because now this is to the government, to come in to help us. And in fact, let me make this appeal directly to the president of this nation. Let the medicines for the post-transplant patient be accessible to each and every person, that they can afford to buy them. Because it is really hard. Most of them, actually most of us, we cannot afford to do this. And what happens is, after the transplant, you need to do some tests. Most of these tests are, let me say, monthly. You need around 7,000. You also need to see the doctor, because you need to be monitored. If this kidney is not monitored, it will reject. So you need to be monitored. You need these drugs. This is lifetime. You cannot stop them. You need them because you need to suppress your immunity. So we're really appealing to the government to really help us. Your thoughts on that, Doctor?
Well, Mary's been very brave to go through that journey, and she's been very strong. And she's given advice not only to our politicians, but really there's a message there for her fellow kidney transplant recipients, who are being reminded by her message that you need to take medication, you need to see a doctor, you must do your very best to ensure that the energy that you've put into it, the suffering that you've gone through an operation, doesn't go to waste and or isn't in vain. And these are very important messages. Of course, our job as clinicians and maybe the government's job broadly is to try and prevent people who have high blood pressure from proceeding to the state where their kidney problems reach the level where you need a dialysis and then eventually a transplant. And as much as it may be a problem to access drugs at that stage. It's really important when you have a diagnosis of high blood pressure and you're started on medication to do something about it, because if you do something about it, you can slow the progression or prevent progression to later complications.
Okay, we'll get to this in just a few moments. Is there a general, I know she mentioned medication I think is about 7,000. How much is, by the time you're going through the dialysis and everything, how much is that for a patient?
Okay, so I'm not a kidney specialist, so I'm not au fait on the figures that dialysis patients will go through. But what I can tell you is the figures for somebody who needs one or two relatively cheap agents for treatment of high blood pressure. And if you think about it this way, it can cost as little as 500 shillings per month to take 2 drugs to manage your blood pressure. And the cost, although that will build up to about 6,000 bob a year, the cost savings if you do that, from facing 7,000 shillings on drugs, on tests, and maybe 20,000 shillings on the post-transplant drugs per month, it makes a lot of sense to try and prevent it from progressing.
Okay. We have 2 tweets. Let's see if we can bring those right now. Okay, the first one is Warutumo _ who says, what's the relationship between high blood pressure and diabetes? I think that was touched on briefly. And at Mutuku Konso says, what are the first symptoms of hypertension that you can be able to notice? Again, I think that's something we touched on briefly. Maybe now I can try and be brave enough. My nerves are calm, so hopefully the readings won't go through the roof.
Sure.
Do I need to stand?
No, you can sit.
Okay.
Let me see if I can get this machine to work. And
then you can just sort of take us through what you're doing.
So this is a blood pressure monitor over here, and the readings will appear in this segment over here. What I need to do is just to ask you to bring your arm over here.
Okay.
And we'll rub this around your arm.
Yeah. Do I hold it or it's okay?
Yeah, you can just balance it over there. And we'll just press this button over here. And this is an automated machine, so what it does is it automatically measures it. Automated machines are not as good as manual machines that a doctor will measure, but they can be calibrated and checked regularly so that the readings that we get are checked and confirmed.
Okay.
And we're just waiting for your numbers here. Perfect. So this is a exemplary blood pressure. It's 106/74. So the top reading, as we wanted, is less than 120, and the second lower reading is less than 80. So congratulations.
So I'm good.
Very good.
You have no idea how relieved I am. And you say that there's a test that people can do at home as well?
Yes, it's possible to get your blood pressure checked at home using your own blood pressure monitor. They cost probably between 5,000 and 10,000 shillings, and there's some which have been validated and tested by different hypertension societies, and there's some which haven't. But generally speaking, you can get them cross-checked by your doctor to make sure that they're giving you an accurate reading.
Okay.
I don't recommend that. I mean, I'm not suggesting that every household needs to have a blood pressure monitor machine. One of the things that worries me is that when people have symptoms like really bad symptoms like chest pain or their face is drooping, and they check their blood pressure and they find it's okay, then they feel reassured that there's nothing serious, when it could be that there's something else going on that hasn't affected the blood pressure. But yes, it's possible to monitor your blood pressure at home if you want to.
Okay. And how often should you monitor your blood pressure generally, just to keep your health in check? How often should someone check their blood pressure?
So if I was to talk to you, Janet, I'd say that the next time you need your blood pressure checked is in 5 years. Okay. It doesn't have to be done that frequently. If your blood pressure reading flags up abnormal, so for instance it's more than 120/80, then you may want to check that more frequently because you are now in the pre-hypertension range, and it may be necessary for us to make sure that you don't progress into the hypertension range. Once you've got high blood pressure, then of course some adjustments will be made, whether they're lifestyle or medication, and we need to keep an eye on that. So we may be checking your blood pressure once a week for a short period of time, or once a month, or once every 6 months.
All right. Mary, how are you feeling now, health-wise, generally? How are you feeling?
Yeah, health-wise, I can say I'm very okay. I feel healthy, not like previously when I had to depend on dialysis machine 3 times a week. Yeah, I'm generally okay. Apart from the issue of the meds, actually I want to correct you about something. You've talked of 7,000. It is not 7,000. My case, right now I'm on medication worth 58,000 per month. That is minus the consultation fee. Yeah, and the test fee. That's what I need to use every month for me to survive. If I don't take that, if I don't swallow those tablets in a month, I'll definitely lose my kidney. Yeah, so the cost of post-transplant medication is very high. Okay. Yeah, you see, it's not easy. One can't raise that money. Actually, even for my case, why it's not for that man, and God bless him wherever he is, yeah, I believe I cannot manage to raise that money. That's why I'm appealing to the government of Kenya.
Yeah, to address that.
To address that issue.
Yeah.
Yes.
Okay,
because we're really suffering.
All right.
Yeah.
But thank you for being brave enough to come and share your story. I know we had Teresa Waringe. She's somewhere in the studio. She's someone that we once hosted as well. And there seems to be a support group that you belong to.
Yes.
That really does help you all sort of get by on a day-to-day.
Yeah, true. Yeah. We have a forum for the kidney patients, actually dialysis and kidney patients, and the friends, those who support us. What we normally do, we come together, we share our problems, because most of the time I can address what I'm feeling. You might not understand, but when I go and meet someone who is having the same issue with me, we get to discuss and see how we can help each other. There are those people on dialysis, so they need our support. Even if we are not on dialysis, so we come together, share ideas, and see how we can help each other.
Are there hypertension support groups? Is there something like that that you know of?
Yes, the hypertension support groups exist, more so outside this country than in this country. There is a society, I mean, in most Western countries, you now have hypertension societies. I'm not aware of one in Kenya. I could be forgiven, perhaps, if one exists, but it's not well publicized. But there's no question, for instance, that people who participate in these support groups do better than people who don't, because the amount of information, which is usually accurate information, that sufferers of a condition have, and they can share and they can remind each other, and maybe find ways, solutions to accessing things that if you don't, you're not part of a support group, you may not be able to access.
Okay, we're just about to take our final break, but any sort of parting shot that you would like to give to someone watching who is either afraid that they're hypertensive or who is hypertensive, any advice that you'd want to give them?
The key thing is to find out whether you have the problem, and if you have the problem, to respect that you have the problem and to do something about it. I would say that most people above the age of 30, probably in Kenya, should have their blood pressure checked at least once. And if you discover that it's on the high range, then you need to report to somebody and say, listen, can you tell me what should be done about this? Most of the time, a repeat reading will come back in the normal range, so you shouldn't be too worried about it. But if we discover that you do have high blood pressure and we can't find an underlying reason, then the bottom line is that you have high blood pressure. Just like some people are growing bald and some people have grey hair. That's something that you have to accept. And there's something that can be done about high blood pressure to prevent it causing the problems in the future.
All right. Thank you both so much. Thank you so much for your expertise and you for sharing your story, like I said, and I wish you all the best.
Thank you, Jen.
All right, we'll take a short break. When we come back, Hussein needs to have his blood pressure checked. He's hiding in a corner, but we'll try and make sure he does it. We'll be back after this. Welcome back. This is the final part of Monday Special. Hussein, who was initially all suited up at the beginning of the show, has now lost his jacket and he's just about to have his blood pressure checked.
Really matters to you,
yes, it does. By Dr. Mohammed Jailan, so we can see. We just want to make sure you're not stressed out, that you're healthy, that you're good,
so I look stressed
that married life is treating you well.
It is treating me well. I can't be stressed out. Maybe before I was married.
Oh, yeah?
It would have been a problem now.
Okay. So we'll take a look at that.
Hoping nothing works against what I said.
And then we'll sample just a little bit of your feedback before we wind up as well.
Have you had this check before, Hussein?
Yeah, a while back.
Very good.
I'm good, isn't it?
We'll find out.
Yes.
Just rest your arm down.
Okay.
It's a little bit high today. So we'll have to repeat this reading.
Really? Could it be because of his nerves?
It could be. I
Okay.
mean, what we normally do...
nervous.
Okay.
And this is a good
The
example.
doctor speaking.
Okay.
What we normally do is we take 3 readings, we separate them by about 15 minutes,
Yeah.
and we take the 2 lowest readings.
Okay.
So hopefully
Yeah.
we'll get 2 low
We'll have to
readings
stay
at
back.
life.
So you'll be fine.
Yeah, I'm fine.
We
I'm
support
fine.
you.
good.
Very quickly, someone says I cook food
You're sure
with lots
about
of
this, doctor?
spices.
Yes,
You're sure about that?
Should be okay.
Yeah. I cook food with lots of spices. My husband is hypertensive. Could I be affecting him in a way? That's something that someone asked.
Well, it depends on how you're spicing your food. The things like michuzi mixes, if you like, have a lot of salt.
Okay.
And the maximum salt that we recommend people who don't have high blood pressure is 1 teaspoon per day.
Per day.
Per day.
Very few people do it.
And perhaps one of the key things to say is that these processed things, like the curry powders and so on, can have salt, silently introduced. Bread is a very a good example. There's a lot of salt. There's more salt than you need per day in 4 slices of bread that's processed at the moment. So one has to be careful.
Everyone's gasping because I think we're all pretty guilty of that. Yeah, it's very frightening. Okay. So many questions. I don't think we can get through all of them today. I don't know if you have any.
We'll try and channel some to him. A lot of questions. We'll just leave the questions like that because we'll channel them to him. But people talking about how expensive it is to treat this. I can assure you from these 3 decades as a patient, you will require not less than 5,000 shillings per month on drugs for these. But somebody again here says, point of correction, drug goes up to 30,000 per month. So it's a big problem, isn't it?
Yeah, which is what Mary, I think, also mentioned. Yeah, so I don't know if you have any more texts. It's mostly questions,
It's
I
mostly
think.
questions, yeah.
And I think we're good with the tweets as well. We've shown some of those. Okay, so I think that's how we wind up. Oh, right. Kanze
He has done his...
Oh, Kanze is insisting that we... What's that? Okay, I think she still wants to
know what?
I'm not sure, Kanze, what you want to know. Oh yeah, she wants to know the reading, Hussein's reading.
So perhaps Hussein can read it to us.
143
over
100. How bad is that?
Well, we can repeat it and hopefully it'll come back into the normal range. But this would be considered an abnormal reading because the lower reading is very high.
Okay.
Okay, abnormal reading, he says, sounds very bad. But anyway, thank you so much.
You're very welcome.
Yeah.
We'll try and do this off screen.
Well, yes.
And I'm sure it'll go down.
Yeah, I'm sure it will. Thank you so much, Dr. Mohammed Jailan. And Mary, once again, thank you very much. And thank you for watching Monday Special tonight. I'm Janet Bogwandishu. Have a good night.
Good night, I'm Hussein Mohammed. No pressure.